Cystic fibrosis is an inherited disease that affects the lungs and digestive system. The body produces thick and sticky mucus that can clog the lungs and obstruct the pancreas. In this video, I'll give you a visual mnemonic for the cause, effects, and findings leading to a diagnosis of cystic fibrosis. Note that this video will not cover the complications of the disease, which will be discussed in a separate video. It's time for lunch again, in the cystic fibrosis cafeteria. Man, I wonder what nasty mush the lunch lady has come up with this time. Oh man, look at that green slop on the menu today. Thick and slimy right out of the tube. Doesn't it kind of remind you of mucus? This stuff resembling thick mucus in a tube should anchor you to our scene on cystic fibrosis. One of the hallmarks of cystic fibrosis is thick mucus which clogs the airways and ducts of the GI tract. Just remember this thick mucousy food and you'll have this fact under wraps. Next, let's take a step back to figure out where we are. Yeah, we're in the cafeteria. See those tables out back? By the way, this cafeteria helps me remember the mutated gene that causes cystic fibrosis, CFTR. Get it? Cafeteria for CFTR. Symbols really don't get much better than that one. Next, take a look at myself here, standing in the lunch line. I don't know about you, but I've been sweating bullets just looking at this food. I mean, I have to eat this stuff? Come on! My sweating should help you remember the finding of increased sweat chloride. Because sweat has salt, which is just sodium chloride, right? CFTR actually encodes a transmembrane chloride channel, which is critical for maintaining fluid and ion balance in various tissues. In the sweat glands of the skin, this channel allows for chloride ions to enter the cell. Sodium then follows chloride, so a defect in the CFTR chloride channel causes chloride and sodium to be trapped outside of the cell. In other words, this causes increased chloride at the surface of the skin, which can be used as a non-invasive diagnostic test for the presence of cystic fibrosis. Just remember me nervously sweating about the food here, and you'll remember that sweat chloride is increased in cystic fibrosis. Now let's switch back to that thick mucousy slop in that tube. The CFTR chloride channel is also present at other mucosal surfaces, notably in the GI tract and the lungs. As opposed to the physiologic inward flow of chloride at the skin, chloride normally exits these other surfaces. The chloride outside the cell pulls sodium, which is followed by water. In other words, the CFTR chloride channel actually has a secretory role at most mucosal surfaces, leading to increased fluid volume inside the mucus. But in cystic fibrosis, remember how the CFTR channel is defective. This means that there is decreased chloride secretion, which in turn decreases sodium and water levels in the mucus. The decreased water content of secretions causes the mucus to be, well, very thick and very dry, which explains the characteristic thick mucus that we covered earlier. And I don't know about you, but this green mucousy food looks pretty dry. I guess the lunch lady didn't put in enough water. So we know that the CFTR chloride channel is mutated, but where is CFTR located anyways? Well, let's swivel back to look at me. You see, I've actually already died inside, after looking at this disgusting food. Wait a minute, is that me rising to heaven? And doesn't heaven sound a lot like the number 7? Yeah, this sending off to heaven is here to help you remember that CFTR is located on chromosome 7. Heaven for 7. Cool. Afterwards, every cafeteria line has a water machine, right? But this one has the worst kind of cups. Yeah, I'm talking about those funnel cups that you can't even put down anywhere. The funnel shape of these cups is here to help you remember phenylalanine, also known as phenylalanine. You see, the most common mutation in CFTR is a deletion of phenylalanine at position 508. You will see this written out as phenylalanine 508, and this is high yield to remember. Let's talk about why this phenylalanine 508 deletion is so important, shall we? First, take a look how someone's tripped right into this machine, knocking down all these folded cups. Yeah, you might even say that all these folded cups are misfolded now. This picture should help you remember that a phenylalanine deletion at position 508 causes misfolding of the membrane protein. Test writers can ask you exactly how CFTR is affected, and after seeing this picture, you should know that a defect results from misfolding of the transmembrane channel. This misfolding eventually leads to retention in the rough endoplasmic reticulum instead of shipping to the plasma membrane where the channel is supposed to operate. Again, the CFTR chloride channel normally operates at the plasma membrane, facilitating the flow of chloride ions in and out of the cell. You can imagine then how the flow of chloride might be impaired if this channel gets stuck in the RER instead. Remember the increased sweat chloride in the thick mucus from before? Now you know why this all happens. Got it? Let's move on. So you think you're real brave, huh? Alright, well if you want to eat, go get your tray at the small cart there. Wait a minute, small cart? This small cart is a small auto, which is a recurring symbol for autosomal recessive inheritance. You see, at Pixarize, we symbolize autosomal dominant inheritance with big, dominant autos like trucks and tanks, while autosomal recessive inheritance is represented by small autos like carts. This small recessive cart is here to help you remember that cystic fibrosis is inherited in an autosomal recessive pattern. Next, take a look at that probe stuck inside the food. Are they measuring the temperature or the quality of the food? I don't even know why they bother anymore. Whatever they're measuring, it's super negative. Yeah, just look at that negative number on that probe. This negative probe reading should remind you of the finding of a negative transepithelial potential difference. Let me unpack what this means because it's a bit conceptual. Remember how a defect in CFTR can cause ion changes at mucosal surfaces? Well, a decreased secretion of charged chloride and sodium ions literally changes the voltage gradient across the mucosal epithelium. So when voltage probes are placed across the nasal mucosa, the transepithelial voltage or potential difference measured is more negative than usual. This can be a confirmatory test for cystic fibrosis, although it's really only used in cases where the sweat chloride levels are inconclusive. On the note of diagnostic tests, let me introduce another one you should remember on test day. Remember the klutz who knocked over those funnel cups from earlier? Yeah, this guy literally tripped on his laces. I guess he was so distracted by the food here that he forgot to watch where he was going. The tripping here should help you remember the finding of increased trypsinogen on newborn screening. Get it? Tripping for trypsinogen. Newborns with cystic fibrosis usually have increased trypsinogen in their blood. To understand why this happens, recall how trypsinogen is a pancreatic enzyme typically used for digestion. And as discussed earlier, one of the hallmarks of cystic fibrosis is thick mucousy secretions. These secretions can block the ducts of the GI tract, especially inside the pancreas. And if pancreatic enzymes can't be secreted, they instead leak into the bloodstream. Therefore, increased blood levels of pancreatic enzymes like trypsinogen can be found in patients with cystic fibrosis. This is mainly used as a newborn screening test, but it's important to remember since it also has a pancreatic tie-in. Alright, I'm about done with lunch here. Let's recap before class starts again. Cystic fibrosis is an autosomal recessive disease characterized by a defect in CFTR, which encodes a chloride channel. CFTR is located on chromosome 7, and the most common mutation is the deletion of phenylalanine at position 508. This deletion causes misfolding of the chloride channel, which is then retained in the rough endoplasmic reticulum instead of being transported to the plasma membrane. Patients with cystic fibrosis have increased sweat chloride, which is used as a common diagnostic test. Other test results pointing to a diagnosis of cystic fibrosis include increased blood trypsinogen, as well as a negative transepithelial potential difference. And that's it for this review on cystic fibrosis. Check out our next video for the complications of this disease. Well, it's time for my next class. I'll catch you on the other side.